What are some of the factors you think, Dr. Schwartz, leading to anxiety and fear in your dental office or your dental chair? How do you try to eliminate that?
Well, I think that one of the things that we all have to be better at as dentists, and I think we try to do it in our office, is, as you as a psychologist would know, the anxiety of anticipation is terrible. That's the big problem. So if you're going to leave somebody in the word waiting room for 20 minutes after they're supposed to be there, you're just going to build anxiety and nervousness. So I think one of the great things you can do for patients is not keep them waiting. Make sure that when they come, they're met with a smiling office staff. They're greeted with maybe some water or juice or a cup of coffee, and they're made to feel the same kind of feeling they would feel nurtured by a mother. In other words, at home. The smells of the office. Should it smell like an office, a dental office with eugenol, or should it smell more like, a living room, something where somebody would relax, a salon,
Or a
music.
Five-star hotel.
Exactly. It could be music. Maybe that's not where you play your rock and roll music, but you have something like you had discussed before. You like to have Brahms and Beethoven on, some light classical music. The colors of your office make all the difference in the world. You need to not have colors that subconsciously create danger, or reds. You want soothing earth tones, things that are going to make people more comfortable. You want the office warm. You want to create that warm feeling. And then, of course, the dentist looking at you eye to eye, talking to you, not just to his assistant, and making eye contact when you first come into the office, making sure that he sits with you and he understands where you're coming from, because most of us all have a history. We have a history of where we went, and many times I'll hear the history of, that bad situation and why it was bad, and tell me about it. And then it also gives me a clue as to what the kind of things that I shouldn't do or shouldn't show them, when we're discussing their treatment.